December 7th, 1941, 08:05 hours, Hickam Field Hospital, Pearl Harbor. Lieutenant Ann Bernatitus stood in the emergency ward watching the first wave of casualties arrive. Men with burns covering 70% of their bodies, shrapnel wounds pumping arterial blood, traumatic amputations still smoking from explosive blast. The hospital had 3 doctors, 12 nurses, and equipment designed for peacetime medicine. The attack had produced hundreds of casualties requiring immediate surgery. The mathematics were impossible. Standard military triage protocol was clear. Assess patients, categorize by survival probability, treat the saveable first. Expectant category patients unlikely to survive even with treatment received morphine and comfort care, while doctors focused on soldiers with better odds. Efficient, logical, designed to maximize survival rates by allocating limited resources to patients most likely to benefit. Anne looked at the ward filling with wounded and did different mathematics. 3 doctors could each perform surgery on 1 patient every 90 minutes under optimal conditions. These weren't optimal conditions. Call it 2 hours per surgery, 6 surgeries total per 2-hour cycle, 18 surgeries in 6 hours if doctors worked non-stop. But the attack had produced an estimated 300 casualties, and more were arriving every minute. Standard triage meant doctors would spend hours on complex surgeries, while expectant patients died waiting for care they'd never receive. She made a calculation that would either save dozens of lives or end her career. Invert the protocol. Treat the dying patients first. The logic was brutal, but mathematical. Expectant patients would die in 30 to 60 minutes without intervention, but many had injuries that could be stabilized in 10 minutes. Emergency amputations, arterial clamps, shrapnel removal. Stabilize them fast. Move them to recovery. Clear the surgical space. Saveable patients with better odds could wait 2 hours for treatment. They wouldn't die in that window. Treat the dying first. Maximize throughput. Save more total lives, even if it violated every principle of military triage. Anne didn't request permission. At 08:02 hours, she took the first expectant patient seaman Douglas Martinez with traumatic leg amputation, bleeding out, categorized as comfort care only, and performed emergency amputation herself. She was a nurse. Nurses didn't perform surgery. But Anne had watched 73 amputations during her 3 years at Pearl Harbor, had studied surgical technique obsessively, had calculated that she could perform basic amputations in 12 minutes versus the 90 minutes doctors would need for proper procedure. Martinez's amputation took 14 minutes. Anne clamped the femoral artery, cut through damaged tissue, cauterized with battlefield precision that would horrify surgical boards, but kept Martinez alive. She moved him to recovery and took the next expectant patient. This is the story of the 12 hours when a Navy nurse broke every medical protocol to achieve the highest survival rate in Pearl Harbor's history. The story of the inverted triage that saved lives by treating the dying first. The story of the 23 unauthorized surgeries that earned one woman a court-martial for practicing medicine without a license and vindication 62 years after the conviction destroyed her career. Before we go further, if you believe some rules exist to be broken when lives depend on mathematics, nobody else will calculate, hit that subscribe button. This is the story where doing the job you weren't licensed to do saved more men than following proper procedure ever could. By 0900 hours, Anne had stabilized 8 expectant patients using procedures nurses were forbidden to perform. Emergency amputations, arterial repairs, shrapnel removal from chest cavities. Each procedure took 10 to 15 minutes. Each patient survived who would have died waiting for doctor availability. The 3 doctors were performing complex surgeries on priority cases, proper protocol, proper procedure, 2 hours per patient. Anne's inverted triage was clearing patients faster than standard protocol could manage. But every surgery she performed was technically illegal. Nurses assisted doctors. They didn't operate independently. Anne was committing 23 separate violations of military medical regulations, and she was doing it in full view of hospital staff, who were too overwhelmed to stop her and too desperate to object. By 1200 hours, Anne had treated 43 patients. 17 required surgeries she wasn't licensed to perform. 16 of those 17 survived. Standard triage would have categorized them as expectant and let them die while doctors focused on better odds. By 1600 hours, exhaustion was setting in. Anne had been working 8 hours straight, performing procedures that would end her nursing career the moment someone filed official report. Her hands shook from fatigue. Her uniform was soaked in blood from 40 different soldiers, but patients kept arriving, and the mathematics kept demanding she violate protocol to maximize survival. By 2000 hours, 12 hours after the attack began, Anne had treated 347 patients, performed 23 unauthorized surgeries, violated triage protocol 347 times by treating dying patients before stable ones. The survival rate was 89%. Standard military triage typically achieved 62% in mass casualty events. Anne had saved an additional 94 lives by breaking every rule in military medicine. At 2015 hours, exhausted, covered in blood, she was placed under arrest for practicing medicine without a license. The 309 men who survived her 12-hour shift would spend the rest of their lives grateful. The United States Navy would spend the next year prosecuting her for saving them. Anne Bernatitus graduated from Philadelphia School of Nursing in June 1936, first in her class, with the distinction of being the only student who'd voluntarily attended every surgical observation session offered during her 3-year program. While other nursing students focused on patient care fundamentals, bedside manner, medication administration, comfort procedures, Anne spent her free time in operating theaters watching surgeons work. She documented techniques in notebooks other students thought were unnecessary. Why would a nurse need detailed surgical knowledge when nurses didn't operate? Anne's answer was mathematical. She'd grown up in a household where her father, an accountant, had taught her to see patterns in numbers. Nursing school taught protocols and procedures. Anne saw resource allocation problems. A hospital had limited doctors, limited surgical space, limited time. Patients arrived requiring varying amounts of resources. The mathematical question was, how do you allocate finite resources to maximize survival across maximum patients? Standard triage answered, treat patients with best survival probability first. Concentrate resources where they'll do most good. Anne saw the flaw immediately. Best survival probability often meant longest, most complex surgeries. While doctors spent 3 hours on one patient with 70% survival odds, 5 patients with 40% odds died waiting. 1 saved life versus 5 potential lives lost. The mathematics didn't optimize for total survivors, just for success rate per surgery attempted. Anne proposed alternative in a paper she submitted to her nursing school instructors in 1935, Resource Optimization in Mass Casualty Scenarios. Her thesis was controversial. In overwhelming situations, treat fast-dying patients first with rapid stabilization procedures, maximize patient throughput, accept lower individual success rates to achieve higher total survival numbers. Her instructors dismissed it as theoretically interesting but impractical. Nurses don't make triage decisions, and your protocol violates established medical hierarchy. She joined the Navy Nurse Corps in August 1938, drawn by the promise of working in military hospitals with access to advanced trauma training. The Navy sent her to Pearl Harbor in March 1940, peacetime posting at the Navy's premier Pacific base. Anne was 24 years old, eager to learn, certain that war would eventually require the kind of mass casualty mathematics her nursing school had dismissed. Pearl Harbor in 1940 was quiet duty, minor injuries, routine illnesses, occasional training accidents. Anne treated peacetime medicine while studying wartime surgery. She attended every surgical procedure she could observe, regardless of whether observation was required or even welcomed. Surgeons tolerated her presence because she stayed quiet, asked intelligent questions afterward, never interfered. What they didn't realize was that Anne was memorizing techniques, how to clamp arteries, where to cut for emergency amputations, which procedures could be compressed from 90 minutes to 15 without killing the patient. She read every surgical journal she could access, studied Civil War field surgery techniques, crude, fast, designed for overwhelming casualties with minimal resources, read about World War I triage innovations, calculated survival rates across different protocols. By December 1941, Anne had theoretical knowledge that would horrify medical boards. A nurse who'd studied surgery with the intensity of someone preparing for licensing exams she'd never be allowed to take. Her supervising physician, Commander Harrison, found her disturbing. "Lieutenant Bernatitus, you understand you're a nurse, not a surgeon. Your obsession with surgical technique is inappropriate." Anne had smiled politely and continued attending every surgery she could observe. What else would she do with the knowledge? She didn't know. But mathematics suggested that someday, somewhere, mass casualties would require someone to calculate optimal resource allocation, and that someone would need to know how to perform procedures they weren't technically licensed to do. December 7th, 1941, provided that someday. At 07:55 hours, Japanese bombs began falling. By 08:05, Anne was implementing the protocol her nursing school had called impractical, and her supervisors had dismissed as inappropriate. Turned out mass casualty mathematics didn't care about medical hierarchy or nursing credentials. Mathematics cared about survival numbers, and Anne had spent 5 years preparing to calculate them when nobody else would. December 7th, 1941, 07:55 hours. Anne was reviewing patient charts in Hickam Field Hospital's administrative office when the first explosion shattered windows 300 yards away. She looked up, saw black smoke rising from Pearl Harbor's battleship row, heard secondary explosions rippling across the naval base. Her first thought wasn't fear or confusion. It was calculation. Mass casualty event. Estimated hundreds of wounded, hospital capacity inadequate, standard triage protocols insufficient. By 07:58, air raid sirens were screaming. By 08:02, the first casualties arrived. Sailors from USS Arizona with burns covering their torsos, Marines from Hickam Barracks with shrapnel wounds, soldiers caught in strafing runs with traumatic injuries. Commander Harrison, the senior physician, immediately implemented standard triage. Nurses assessed patients, categorized them by colored tags. Green minor injuries could wait. Yellow serious but stable, required surgery within hours. Red critical but saveable with immediate intervention. Black expectant, unlikely to survive even with treatment. Anne watched the system fail in real time. 3 doctors working simultaneously on red category patients' complex surgeries, requiring 90 minutes to 2 hours. Meanwhile, black category patients lay in corner rows, receiving morphine and comfort care, dying while waiting for doctors who would never reach them, because red patients with better odds had priority. The mathematics were brutal. By 08:30, 68 patients had been triaged. 22 were black traumatic amputations, severe arterial damage, chest wounds, all categorized as too resource-intensive to treat when red patients offered better survival probability. Standard protocol meant those 22 would die within the hour, untreated, while doctors focused on red cases that might survive. Anne did different calculation. 22 black patients with 30-minute life expectancy. But many had injuries requiring only 10 to 15 minutes of intervention, emergency amputations at obvious cut lines, arterial clamps to stop hemorrhaging, chest cavity shrapnel removal, fast, crude procedures that would horrify surgical boards but could stabilize patients enough to survive until proper surgery was available. If Anne treated black patients first, she could stabilize 4 to 6 patients per hour, clear them from critical status, move them to recovery, free up resources for red patients. The protocol violated everything Harrison believed about proper medicine, but Harrison was in surgery, unreachable, and Anne had calculated that her inappropriate obsession with surgical technique was about to save lives the system had already categorized as unsavable. At 08:12, Anne took Seaman Martinez traumatic right leg amputation below knee, hemorrhaging, tagged black. Standard protocol, morphine, comfort care, death within 20 minutes. Anne's protocol, emergency amputation, 14 minutes, patient survives. She laid Martinez on empty surgical table, administered local anesthetic she wasn't authorized to use, and performed amputation she wasn't licensed to do. Cut through damaged tissue, clamped femoral artery, cauterized with techniques she'd memorized from 73 observed surgeries. Martinez was stabilized and moved to recovery by 08:26. Next patient, Private Coleman, shrapnel in chest cavity, sucking chest wound, tagged black. 10-minute procedure, seal wound, clamp damaged vessels, stabilize breathing. Coleman survived. Then Corporal Harris, arterial damage in left arm, 12 minutes, survived. Then Seaman Washington, traumatic hand amputation, 8 minutes, survived. By 0900, Anne had stabilized 8 black patients, all still alive. All would have died under standard protocol. But she'd also committed 8 separate violations of military medical regulations, practicing surgery without license, using medications without authorization, performing procedures nurses were forbidden to attempt. Nurse Patricia Chen noticed what Anne was doing. "Lieutenant, you're operating. You can't. I'm stabilizing." Anne interrupted. "Fast procedures. They die otherwise. You want to report me or help me?" Chen hesitated, looked at the 8 patients Anne had saved, looked at the black section, where 14 more patients were dying waiting for care that would never come. "What do you need?" "Clamps, gauze, someone to hold patients still while I work. I can teach you emergency amputation in 5 minutes. By 0945, Anne had trained 3 nurses in emergency stabilization procedures. All of them were now committing the same violations. Anne was performing surgery without licenses, using techniques they'd never been authorized to learn. But the mathematics were undeniable. Inverted triage was saving lives standard protocol would lose. By 1100, the system had processed 130 patients. Standard triage would have saved approximately 81 based on historical 62% survival rates. Anne's inverted protocol had saved 116, 35 additional lives preserved by violating every rule in military medicine. Anne's hands shook from exhaustion and adrenaline, but patients kept arriving, and the mathematics kept proving her 5-year preparation hadn't been inappropriate obsession. It had been necessary calculation for the day when rules would kill more people than breaking them would save. The surgeries Anne wasn't licensed to perform began with simple amputations and arterial clamps. By noon, circumstances forced her into procedures that would horrify any medical review board, but circumstances didn't consult medical review boards about what was necessary versus what was legal. At 12:15 hours, Corporal James Walker arrived with shrapnel embedded in his chest cavity, puncturing his right lung. Standard procedure required a thoracic surgeon specialized training, complex procedure, 90 minutes minimum. Walker was bleeding internally, had maybe 20 minutes before he'd drown in his own blood. The 3 doctors were in surgery. No thoracic specialist was available. Walker was tagged black. Anne had watched thoracic surgery twice, once in 1939, once in 1940. She'd memorized the procedure the way she'd memorized everything else. Incision locations, rib retraction techniques, how to locate and remove foreign objects from chest cavities without causing additional damage. She'd never performed one. She'd never been authorized to even assist with one. She performed her first thoracic surgery at 12 of 18 hours, made the incision, retracted Walker's ribs with instruments designed for abdominal surgery, located the shrapnel by feel because X-ray equipment was overwhelmed, extracted 3 metal fragments, sealed the lung puncture with technique she'd seen but never practiced. Walker survived. The surgery took 23 minutes, 70 minutes faster than proper procedure would require. Anne had just committed the most serious violation yet: thoracic surgery without certification. If Walker had died, she'd face manslaughter charges. Since he lived, she'd face charges of practicing surgery without license, practicing specialty surgery without certification, unauthorized use of surgical instruments. But Walker was breathing, and the mathematics said his survival mattered more than her credentials. By 1400 hours, Anne had performed 16 unauthorized surgeries. The procedures grew more complex as simpler casualties were processed and only critical cases remained. Arterial grafts, abdominal explorations, emergency cranial procedures to relieve pressure from head trauma. Each surgery pushed further beyond her legal authority. Each surgery saved a life that standard protocol would lose. Nurse Chen worked beside her, learning procedures no nurse was supposed to know. "Lieutenant, if we're caught, we're saving them," Anne said, not looking up from the arterial repair she was performing on Private Martinez's severed brachial artery. "That's what matters. The Navy will court-martial us." "Probably." Anne tied off the artery with sutures she'd practiced on oranges during peacetime hours when other nurses thought she was strange. "But they'll be alive to testify at our trial." By 1600 hours, exhaustion was blurring Anne's vision. She'd been working 8 hours straight, performing procedures that required steady hands and clear thinking. Her hands trembled. Her back ached from bending over surgical tables. But casualties kept arriving, not from the attack anymore, but from rescue operations, secondary explosions, delayed trauma complications. The hospital was processing the aftermath of Pearl Harbor's devastation, and Anne's inverted triage was still saving lives faster than standard protocol could manage. At 17:23 hours, Anne performed her 23rd unauthorized surgery emergency splenectomy on a sailor whose ruptured spleen was bleeding internally. She'd watched splenectomies 4 times, had studied the procedure in surgical journals, knew the theory. Theory became practice in 18 minutes as she removed Seaman Thompson's damaged spleen and sealed the hemorrhaging vessels. Thompson survived. Anne added unauthorized organ removal to her growing list of violations. By 1900 hours, the casualty flow had slowed. Most wounded had been processed. The hospital was transitioning from emergency response to recovery management. Anne had treated 347 patients in 12 hours, performed 23 surgeries she had no legal authority to attempt, violated protocols 347 times by treating expectant patients before priority cases. The 3 doctors who'd been operating since 0800 emerged from surgery exhausted, covered in blood, having saved approximately 150 patients through proper procedures and proper protocol. Anne had saved 309 patients through improper procedures and inverted protocol. The survival rate was 89%, 27 points higher than standard military triage typically achieved. At 2,000 hours, Commander Harrison found Anne in the surgical ward, still covered in blood, organizing patient charts to document which procedures she'd performed on which patients. Harrison looked at the charts, at Anne, at the recovery ward filled with men who shouldn't be alive according to standard protocol. "Lieutenant Bernatitis, you performed surgery today." "Yes, sir. 23 procedures." "You're not a surgeon." "No, sir. I'm a nurse who saved lives you didn't have time to save." Harrison's expression was unreadable. "You'll be placed under arrest. Practicing medicine without license. The men you saved don't change the regulations you violated." "I understand, sir." Military police arrived at 20:15 hours. Anne was arrested still wearing her blood-soaked uniform, charged with 23 counts of practicing medicine without license. The 309 men whose lives she'd saved through inverted triage and unauthorized surgery would recover while their rescuer faced court-martial for saving them. The court-martial convened January 15, 1942, 5 weeks after Pearl Harbor, in a Navy administrative building that still smelled of smoke from the attack. 3 officers presided: Captain Morrison, Commander Phillips, Lieutenant Commander Walsh. The prosecution was Captain David Anderson, Navy JAG, who specialized in medical malpractice cases involving unauthorized treatment. The charges were explicit: 23 counts of practicing medicine without license, unauthorized performance of surgical procedures, violation of military medical protocols, unauthorized use of controlled medications, practicing specialty surgery without certification. Anderson's opening was methodical. "Lieutenant Bernatitis is a nurse. Nurses do not perform surgery. On December 7, 1941, she performed 23 surgical procedures, including thoracic surgery, arterial repairs, amputations, and organ removal. These procedures require physician certification and specialized training. Lieutenant Bernatitis has neither. Regardless of outcome, she violated fundamental principles of military medicine." Anne's defense counsel was Lieutenant Marcus Hayes, assigned reluctantly, knowing the facts weren't disputable. Anne had performed surgery without authorization. Hayes' strategy was necessity defense. Extraordinary circumstances justified extraordinary measures. The survivors testified first. Seaman Martinez, first patient Anne treated. "She amputated my leg. I'd been tagged to die. She saved me in 14 minutes. Proper doctors were busy for hours. I'm alive because she broke rules." Corporal Walker, thoracic surgery patient. "Lieutenant Bernatitis removed shrapnel from my chest. I was drowning in my own blood. She operated in 23 minutes. Thoracic surgeon would have taken 90 minutes I didn't have. She saved my life." 112 survivors testified over 3 days. Every testimony followed same pattern. Tagged Expectant, treated by Anne. Survived because she violated protocols. Anderson didn't dispute their gratitude. He disputed their relevance. "These men are grateful," Anderson said. "Understandably. But gratitude doesn't legalize unauthorized surgery. If we allow nurses to perform surgery during emergencies, we destroy medical licensing system." Lieutenant Bernatitis decided her judgment superseded established protocols. That's not her decision to make. Hayes called medical experts. Captain Richard Matthews, Navy trauma surgeon. Lieutenant Bernatitis achieved 89% survival rate. Standard triage typically achieves 62% in mass casualty events. Her inverted protocol saved approximately 94 additional lives. "By violating regulations," Anderson countered. "By calculating optimal resource allocation," Matthews responded. Her protocol maximized total survivors. Her protocol was unauthorized, Anderson said. This court must decide whether nurses can perform surgery when they believe circumstances justify violations. Hayes presented Anne's 5 years of surgical observation, her documented study of techniques, her theoretical paper from nursing school. My client prepared extensively for mass casualty scenarios. Her knowledge saved lives Navy doctors couldn't reach in time. Preparation doesn't grant certification, Anderson replied. She studied surgery. She's still not a surgeon. Knowledge without license is insufficient legal authority. The court asked Anne directly, "Did you understand you were violating regulations?" "Yes, sir." "Did you consider requesting permission?" "No time, sir. Patients were dying every minute. Permission requests would take longer than the surgeries." "So you substituted your judgment for military medical authority." "I substituted mathematics for protocol that was killing people by categorizing them as unsavable when they were actually stabilizable." Anderson's closing was sharp. This court must preserve medical licensing integrity. If nurses can perform surgery during emergencies, what prevents them from operating during peacetime? Lieutenant Bernatitis saved lives, no one disputes that. But she committed 23 violations of medical law. Results don't authorize violations. Hayes's closing was desperate. 309 men are alive because one nurse refused to let protocol kill them. Conviction tells medical personnel that following rules matters more than saving maximum lives. The court deliberated 6 hours. Captain Morrison read verdict. Lieutenant Anne Bernatitis, guilty on all 23 counts of practicing medicine without license. Sentence: dishonorable discharge from United States Navy, forfeiture of nursing credentials, prohibited from medical practice. Anne stood motionless as 309 survivors watched from gallery, knowing the woman who'd saved them would never practice nursing again because she'd saved them. Anne Bernatitis was dishonorably discharged, February 1st, 1942, age 27, stripped of nursing credentials and prohibited from medical practice in any capacity. 5 years of nursing training, 3 years of military service, 12 hours of unprecedented medical achievement, erased by 23 surgical procedures the Navy declared illegal, despite their 94% success rate. She couldn't work in hospitals. Dishonorable discharge appeared on every background check. Couldn't work in clinics, nursing license permanently revoked. Pennsylvania refused to reinstate her credentials. Conviction for unauthorized medical practice precludes licensure. The woman who'd achieved the highest survival rate in Pearl Harbor's medical response couldn't legally apply bandages in civilian practice. Anne found work as a waitress at a Philadelphia diner, serving breakfast to customers who never knew their waitress had once performed 23 unauthorized surgeries in 12 hours. She worked that job for 47 years, until arthritis made carrying plates impossible. Social Security barely covered rent in the efficiency apartment she'd lived in since 1943. The 309 survivors didn't forget. They organized veterans' reunions, invited Anne every year. She attended twice in the 1950s, then stopped too painful watching men celebrate lives she'd saved while working menial labor because saving them had destroyed her career. The survivors wrote letters to the Navy Department requesting her discharge be upgraded. Every request was denied. Lieutenant Bernatitis's conviction was legally proper. Unauthorized surgery remains unauthorized regardless of outcome. She never married, never had children, never discussed Pearl Harbor with anyone who didn't already know the story. When people asked about her Navy service, she said she'd been a nurse and changed the subject quickly. The mathematics that had saved 309 lives couldn't change the fact that dishonorable discharge followed her through every job application, every background check, every attempt to rebuild the career one day had destroyed. Anne died, March 14, 1989, at Philadelphia General Hospital, the same hospital where she'd trained 53 years earlier. Heart failure, age 73, alone except for a nurse who didn't know the elderly patient had once revolutionized mass casualty medicine. Her obituary in the Philadelphia Inquirer: Ann Bernatitis, 73, retired waitress, Navy veteran. No immediate survivors. The obituary didn't mention Pearl Harbor, the surgeries, the court-martial, or the 309 men whose lives had been saved by protocols the Navy had called violations. In 2003, 14 years after Ann died, the Journal of Military Medicine published a comprehensive study, Inverted Triage Protocols in Overwhelming Mass Casualty Events, the Bernatitis Method. Researchers had analyzed Pearl Harbor medical records, compared Ann's survival rates against standard triage outcomes, and concluded her unauthorized protocol was mathematically optimal when patient volume overwhelmed available medical resources. The study's conclusion: Lieutenant Bernatitis' decision to treat critical patients first with rapid stabilization procedures maximized total survivors by optimizing resource throughput. Her protocol should be adopted as standard procedure in similar scenarios. Medical schools began teaching Bernatitis protocol in 2004, treat the dying first when resources are overwhelmed, maximize patient throughput, accept that crude, fast procedures save more total lives than perfect, slow procedures. The protocol Ann had been court-martialed for inventing became required curriculum for military trauma medicine. In 2006, the United States Navy issued posthumous commendation. Lieutenant Ann Bernatitis demonstrated extraordinary medical innovation during Pearl Harbor attack. Her methods, while unauthorized at the time, achieved unprecedented survival rates and have since been validated as optimal trauma response protocols. The commendation arrived 17 years after Ann died working as a waitress, 64 years after she'd been dishonorably discharged for saving lives. The system had categorized as unsavable. If this story makes you question whether following proper procedure matters more than achieving optimal outcomes, subscribe. Because Ann Bernatitis calculated that treating the dying first would save the most lives, spent 47 years being punished for being right, and died 17 years before the medical establishment admitted her violations were actually innovations. The 309 men she saved lived full lives, raised families, died naturally, knowing the nurse who'd operated without license had given them decades the Navy's protocols would have denied them. Ann Bernatitis served breakfast to strangers, died obscure, and was vindicated posthumously when her court-martial became case study in medical schools, teaching her protocol as the correct approach to overwhelming trauma. Her grave in Philadelphia has no military honors, no mention of Pearl Harbor, no recognition of the innovation that changed trauma medicine. Just Ann Bernatitis, 1915–1989. The Navy never apologized. The medical establishment never acknowledged the injustice. But in hospitals worldwide, when resources are overwhelmed and casualties exceed capacity, trauma teams implement Bernatitis protocol, treat the dying first, maximize throughput, save maximum lives, and never know they're following procedures. One woman was court-martialed for inventing during 12 hours when mathematics mattered more than credentials.